Hello BNI members, welcome to Inline Wellness Center. I know that a lot of you have been to the office, but for those of you who haven't, we figured rather than bring the office to you, it would be a lot easier if we just took you on a virtual tour. So come on in. This here is our front desk in our waiting area. This here is Tara. She's
Hi
our
BNI!
front desk. This here is where patients check in. Rather than sign in manually, they do it digitally. They'll hit a PIN number, and then they'll enter all their subjective complaints, and then all that will be relayed back to me in my adjusting room. And if you take a look over here, we do sell some supplements and some vitamins, and this is also where I do my 8 weeks to wellness orientation. We do that once a month, and we're a firm believer in education. Doctor does mean teacher, and it's very important to teach our patients how to take care of themselves. We also have some aids that people can use at home to take care of themselves, as well as other supplements here. Now I'm going to show you what an adjustment looks like. This is Nadia. She's our 8 weeks to wellness concierge, and I'm going to adjust her. And I'm going to walk you right through the adjustment, show you what I'm looking for, show you exactly how the adjustment is performed, and then show you the end result. Okay? All right, Nadia, so why don't you lay face down for me?
Thank you for calling Inline Wellness. This is Tara. How can I help you?
Face down. See, she gets smarter after the adjustment as well.
Thanks.
Okay, let your arms hang down. Okay, so one of the first things that I do before adjusting the patient is I do my assessment, which one of the first things that I do is check the leg length, because that'll tell me a lot what's going on in the pelvis. So if I'm checking her leg length, okay, and we come here, you can see, I hope you can see, that Nadia's left leg right here is about, I would say, 1/4 of an inch short. And then I'm going to flex them up, and you can see it's still about 1/4 of an inch short. Now that tells me that it's either the sacrum, which is the tailbone, or the lumbar spine that's involved. So I'm going to feel and see what's going on. And I can feel right away that it's her sacrum that is tilted to the right. So I'm going to adjust her sacrum while she lays on her side. Okay, so I get the patient into position, contact the sacrum, lay them on the side, and just relax. Good. Okay, now lay on your back. Okay, and now I'm going to adjust her neck. Now, a lot of times patients are a little leery about the neck adjustment, but it's very, very safe. I always tell people my malpractice insurance is less than my car insurance. I've been in practice for 22 years, grew up in a chiropractic family, and it's just very safe. And the noise that you hear, a lot of times people are afraid of the noise. The noise is just a releasing gas, just like when you crack your knuckles. So I'm going to go into my palpation. I'm going to feel her neck. And I know Nadia, I've known her for a year, and I know what she does. She does a lot of computer work, so she carries a lot of tension in her neck. So I'm going to find the misalignment and correct it. Good. And it's still attached. Okay. Okay, now that I've finished adjusting her, I'm going to recheck her leg length to make sure that she's balanced out. So if we look at her legs, you'll notice that her legs are perfectly even now. When we flex them up, again, perfectly even. That tells me that she's balanced out, that her nervous system is clear, and everything's in alignment. And that's what we're looking for. Okay, this is our exam room. This is where I do my initial exam when patients first come in. The first thing that I do is I do a case history, ask the patient all the pertinent questions. Once I have got that information, we put them through our physical exam, which may be a little different than just what the average chiropractor does. We'll do orthopedic and neurological testing, but we'll also put them through some functional movements to see how well they're moving. We'll check their posture, which is what you see over here. This is our posture zone. I'll take a digital picture of the patient, and then that'll help me analyze their posture through a software program. Not everyone gets x-rays, but for most people, if they've had any traumas, if they've had some chronic issues, I probably going to want to see films on them. So we have an x-ray machine on site, and I will assess the patient's x-rays really to find out exactly what needs to happen with their spine. When they come in for their second visit, after I reviewed their x-rays, That's when typically they'll get their first adjustment, and then we'll talk about a care plan. So one of the other things that I want you guys to know is that I don't adjust every patient the same way. I'm here with one of my good patients, Lucy, and Lucy has some arthritis in her neck, so we do things a little bit differently. I use this instrument here, which is designed to help align the spine and also help stimulate the joint. So I'm going to show you how that's done. Okay, Lucy, just tuck your chin a little bit for me. Like that. Okay, so this is just another way of adjusting the sacrum using a drop table. What you see here is a flexion distraction table, and this really is good for getting some separation in between the vertebrae where the nerves come out. It's also very good for people with herniated discs in the lower back to get some separations, help the disc to fall back into normal alignment. So we're just going to get a quick word here. So, all right. So I'm gonna. All right. So this is Lucy, and she's been my patient for a long time. So Lucy, let me ask you, how do you feel after an adjustment?
I feel terrific.
Yeah.
I always feel so much better.
That's
I
great.
feel less pressure.
Yes, we
It
are.
really has helped me.
That's great.
It really has.
All right.
And you've always taken care of me.
Yes, I have. All right. Thanks, Lucy.
Thank you, Dr.
All
D.
right.